on the web, and in your hands. This is MDI-TV.
Over 43 million Americans smoke. Most wish they didn't. Internist Dr. Charles Benz sees patients who smoke every day. Most know they shouldn't. Many of them have tried to quit, and there are those who just would rather not talk about it anymore. But Dr. Benz says talking with them about quitting is the most valuable thing he can do as a primary care doctor.
One of the most important things you can do as a smoker is to quit. There's nothing more important to increase the health and the longevity of the patients we serve is to help smokers quit.
A new review of the evidence indicates it's also very important how doctors talk to their patients about smoking and quitting. Coming off as judgmental can be a turnoff to patients. Instead, a technique called motivational interviewing can boost quit rates. One of the minds behind motivational interviewing, Dr. William Miller, describes the technique as a way of talking to people.
Imagine a continuum of styles of communicating. And at one end is directing, which is telling people what to do, basically. At the other end is following, which is simply sitting and listening to a person and understanding their perspective. And in between those two extremes is an area called guiding. And guiding is where motivational interviewing lives. And what you want is for the patient to change their behavior, guiding is really the best place to be. And very often that's one that physicians haven't learned in medical school.
Now, a systematic review published by the Cochrane Library concludes that smokers counseled with motivational interviewing were 23% more likely to stay off cigarettes. Researchers Dr. Douglas Lai-Tai and Dr. Kate Cahill pulled together data from 14 trials that involved a total of more than 10,000 smokers, comparing those who received motivational interviewing with smokers who just got the typical brief advice from their doctors and some quit smoking pamphlets. Dr. Benz says that although he didn't learn about motivational interviewing in medical school, he's not surprised to hear that it does help people get off cigarettes.
This Cochrane review actually does add that you can say now that motivational interviewing as a method is evidence-based, and it's not just a good idea, but it's something that has been proven to be effective.
But there's a catch. Motivational interviewing takes 20 minutes, and it's 3 times more likely to be effective when a primary care doctor leads the sessions. Dr. Benz says he rarely has that kind of time with his patients.
And when you're stuck within a 10-minute visit or a 15-minute visit, there's just no time for any of this, which is why, unfortunately, most providers won't bring it up because they realize, well, if I bring it up, that's another 10 minutes at least, and I will get behind, and I'm already a half hour behind.
While Dr. Benz says he tries to apply motivational interviewing to help his patients, he can't give them all the time and attention he'd like to. So he refers them along to state tobacco control programs, where counselors can help lead them back to healthy, fresh air.